The only medical facilities in the area are run by the humanitarian organisation Médecins Sans Frontières, but it's also been badly affected by the violence. The small hospital in the town of Pibor and the clinic in the nearby village of Le Congol have been looted and damaged, and many of the 150 locally hired staff are among the thousands of people who fled. Deputy Head of Mission for South Sudan, Jean-Marc is based in the capital Juba. He says MSF is still trying to gauge the scale of the emergency.
We are worried about the situation of these people who now don't have access to any kind of health services and who are probably in need of humanitarian assistance like food, shelter and other relief items.
And of course they may also need emergency care as a result of the violence, I guess.
Exactly. We're struggling to get information, but we are desperate to get back in and do an assessment of the situation, see if there are wounded people who actually need some surgical care.
But how damaged are the MSF facilities and equipment there?
Well, we haven't been able to verify it for ourselves because we had to evacuate the team, but we hear reports that it's been looted and parts of it have been damaged. So we don't know to what extent, but we're pretty sure it won't be functional for the foreseeable future.
So that means it could take you some time to mount the emergency response that's needed in the area?
Yes, we may have to launch mobile clinics or a different kind of intervention, but that we can only decide when we clearly identify the needs.
So how committed is Médecins Sans Frontières to staying in South Sudan when it is itself such a target for violence?
Well, for a humanitarian organisation like Médecins Sans Frontières, it's incredibly important to be there where the needs are most acute. So for us, it's extremely frustrating not to be able to respond at this point in Jonglei, but we are responding to other emergencies in different parts of the country, and we are committed to continuing doing that.
And we wish you well with that.
Thank you very much.